This is a guide for social distancing for rheumatology patients on immunosuppressants and steroids during the COVID-19 pandemic. This guide was produced by the Leeds Teaching Hospitals NHS Trust Rheumatology Consultants. If you have a rheumatological condition and are taking immunosuppressant therapy, we ask you please to continue taking your medication as prescribed. At the time of writing, there is no conclusive evidence from across the world for our patients on biologics or immunosuppressants being worse affected by COVID-19. Though the data is limited, this is reassuring, given how many patients are using these medications across the world. The risk of stopping your medication is an uncontrolled flare of your disease. This means that you may have to take extra steroids, which carries a risk of infection or even hospital admission. It is essential that you follow government advice on all measures designed to keep us well. These include washing your hands regularly, using a tissue for coughs, and avoiding touching your face. We have produced a guideline to help you identify whether or not you're at high risk of COVID-19, and I'd like to take you through this chart now. Starting at the top, we ask, do you take any of the medicines in the blue box or prednisolone? If you don't, this guidance doesn't apply to you, and we ask you to follow the standard social distancing guidelines we discuss later. The medicines in the blue box include conventional immunosuppressants such as azathioprine, leflunomide, methotrexate, mycophenolate, cyclosporin, cyclophosphamide, tacrolimus, sirolimus. They also include the biologic and targeted synthetic medications such as rituximab within the last 12 months, or any of the anti-TNF drugs, etanercept, adalimumab, infliximab, golimumab, and certolizumab. They also include tocilizumab, abatacept, belimumab, anakinra, secukinumab, ixekizumab, ustekinumab, saralimumab, canakinumab, apremilast, baricitinib, tofacitinib, or any of the biologic biosimilars. If your answer is yes to that question, please ask yourself the following. Do you take 20 mg or more of prednisolone a day and have done for the last 4 weeks? Or do you take one medicine in the blue box and 5 mg or more of prednisolone for the last 4 weeks? Or have you received a drug called cyclophosphamide within the last 6 months? Or do you have pulmonary hypertension? If the answer is yes to any of those, we ask you to follow the shielding guidelines as recommended by the government, which we will explain also later. If your answer is no to those questions, please ask yourself the following in the orange box. Are you over 70 years old? Have you had one of the following: diabetes, lung disease, kidney disease, angina, heart attack or heart failure? Or do you need tablets for your blood pressure? This includes involvement of your lungs, heart or kidneys from your rheumatic disease. Have you needed extra treatment for a flare in the last 3 months? Do you get recurrent infections? If you've answered yes to any of those, how many of the medicines in the blue box do you take? If you take 2 or more medicines, or take prednisolone at a dose anywhere between 5 mg and 20 mg a day, we ask you to follow the shielding recommendations as advised by the government. If you only take one of the medicines in the blue box, we advise strict social distancing, which we will explain later. If you don't take any of the medicines in the blue box, we ask you to follow standard social distancing guidelines. If you didn't answer yes to any of the questions in the orange box, again, how many of the medicines in the blue box do you take? If you take 2 or more, or take prednisolone anywhere between 5 and 20 mg a day, we advise you to follow strict social distancing guidelines. If you take one or don't take any of the medicines, we again ask you to follow standard social distancing guidelines. The standard social distancing rules involve staying at home with no unnecessary journeys or social contact. They ask you to only leave home for essential shopping or medical needs. They ask you only to exercise once a day outside and only travel to work if absolutely necessary. Our strict social distancing rules include staying at home with no unnecessary journeys or social contact. We ask you if someone else can do your shopping for you or collect your medications rather than you leaving the house. We ask you not to exercise outside the home. And we ask you again to work from home. The full shielding recommendations can be found on the government website. Shielding is the best way to keep yourself safe during this pandemic. If you're extremely vulnerable, you should now strictly avoid contact with someone who is displaying symptoms of coronavirus. These symptoms include high temperature and/or a new and continuous cough. We ask you not to leave your home for a minimum of 12 weeks. Home is the safest place for you. Staying in helps you stay well, and that will help the NHS too. You can open a window, but do not leave your home, and stay 3 steps away from others indoors. Regularly wash your hands with soap and water for 20 seconds. Ask carers or support workers who visit your home to do the same. Don't attend any gatherings. These include gatherings of friends and family in private spaces such as family homes or weddings. Don't go out for shopping, leisure or travel, and when arranging food or medication deliveries, ask them to be left at the door to minimise contact. Keep in touch using remote technology such as phone, internet and social media. Use telephone or online services to contact your GP or other essential services. If you do need to contact your GP about anything during this period while you are shielding, make sure you tell them that you're extremely vulnerable, as they may not have this information recorded. If this isn't possible, please go to the government website for coronavirus in the extremely vulnerable to register and ask for help, or alternatively call 0800 028 8327. Thank you for listening.